Okay.
Good morning everyone, this is Dr. Ninad here. I am the Regional Clinical Coordinator for Apollo White Dental for Maharashtra. Today I am here at the Apollo White Dental Center at Apollo Hospital in Navi Mumbai, Belapur. I am making this video to reach out to all our patients who have been coming to us for their dental treatment over the past 4 years, and also to anybody who is in need of any kind of dental treatment. Though we are going through very difficult times because of this COVID-19 pandemic, I would like to inform everyone through this video that we are continuously taking patients and catering to their dental needs. In April and May, when there were the peak of the pandemic going on, we were taking online consultations and doing only emergency treatment. But now we have started with all routine dental work also. Let me mention that we are taking the maximum precaution and maximum infection control protocols are already in place, so that there is very minimal chance of any kind of transmission of COVID-19 at the dental clinic. These protocols are right from the time the patient is entering into the hospital to the appointment of the patient and the post-operative care of the patient. As the patient comes into the hospital, there is a separate entry which is there for the patients, and a temperature checking is done, as well as the symptoms of any COVID-19 symptoms like flu or fever or any cough. The patient is directed to a separate part of the hospital, which is the flu clinic. This is completely separate from the other areas of the hospital. Then the patient comes onto the waiting area of the dental, which is on the first floor. Let me just take you into the clinic now so that I can show you what all protocols we have kept in place, so that you're confident that the utmost of care is being taken for you. As we enter into the reception area, we used to initially have 4 to 5 chairs in the reception of the dental, but now we have removed 2 chairs so that there is a social distancing which is maintained at all points of time. Also, we make sure that we give all prior appointments to our patients so that there is no crowding which is happening in either the reception or the dental operatories. We move further to the place where the front office executive is seated. As you can observe, the tables have been made specifically so that there is an automatic distance which is maintained between the patient and the front office executive. Also, a sanitizer has been provided at the reception so that the receptionist as well as the patient can do a proper hand hygiene before going into the dental operatory. Once we move into the dental operatory, we observe that there is a patient which is going on right now. The doctor as well as the chairside assistant will be wearing a complete set of personal protective equipment throughout the entire process. Let me make a point over here that even for a regular checkup of the patient, the doctor as well as the chairside assistant wear a complete set of personal protective equipment, so that there is absolutely minimal chance of any transmission from the patient to the doctor or the doctor to the patient. Also, as all dental procedures are highly aerosol generating procedures, we have made an extra provision of a pedestal fan which directs the aerosols from the dental chair to the window behind, and that window has been opened so that there is a dispersal of the aerosols which happens between the procedures. We also now go through the protocols which we are following between the two patients for the proper cleaning and the disinfection. We space the appointments apart from each other by at least a half an hour, so that there is a provision for a deep cleaning to happen of the entire dental chair and the entire operatory between the two procedures. Let me mention here that all the cleaning protocols which are being followed are the same as what are being followed in the dental operation theatre also in the hospital. With this in mind, we have taken maximum precautions to prevent any kind of cross-transmission of any infection at the dental operatory. Though I understand that everybody is maintaining social distancing and staying at home and staying safe is the protocol, but COVID-19 is just one of the diseases which is existing. We all have all other dental and other medical concerns which need to be taken care of. So by this video, I would just like to reach out to all our existing patients as well as anybody who would want to come in for a dental treatment, that we are fully prepared. On Monday to Saturday, we are functional at Apollo Hospital in the dental department. Thank you.